So in continuation with our journey to establish Bombay Hospital as a center of excellence in the field of sleep medicine, today we'll be talking about a novel procedure called DISE.
So DISE is drug-induced sleep endoscopy. It's a very specialized test which we are doing for all our sleep apnea patients. Essentially what we are doing is that we are simulating sleep under controlled environment with anesthesia, with the anesthetist standby, with the chest physician pulmonologist standby, and we are recording with an endoscope when the patient is sleeping. We are looking at areas where there is obstruction in the breathing pathway, starting from the nose, the palate, the oral cavity, and the tongue and the epiglottis. This helps us to actually make our diagnosis more correct, gives us the areas where there is obstruction which needs to be addressed, and when we do plan for surgery, this tells us which are the surgeries which are going to help this particular patient.
So let's talk how DISE actually helped one of our patients. We have a patient who's come down from Belgaum. He's the son of a doctor, a young athlete, non-obese, fit, suffering from daytime symptoms of sleepiness, snoring, nocturnal awakenings, and a poor quality of life. He's not the typical obstructive sleep apnea patient which you would see, yet he had a moderate sleep apnea. So we offered him a drug-induced sleep endoscopy after getting a scan of the upper airways, sinuses, and the neck. And his findings surprised us and helped us establish the way forward in correcting him.
So when we did DISE for this patient, I realized that he's got palatal obstruction, which is what we say talu. He had nasal obstruction, nasal blockage, because of which he couldn't breathe by his nose. He had problems at his tonsillar levels, and which is what was compressing his oral cavity while breathing and sleeping. So we made a customized plan for him to reduce the size of the palate. But it was a novel technique, not just reducing the palate, but reducing the size of the palate at the same time maintaining the function. That was difficult, but it went off very well. And I think eventually what we are looking at is a significant reduction in his sleep apnea score and eventually improving his quality of life, quality of sleep. He's a young boy, so I'm sure he'll be helped a lot.
I just like to say a few words about pulmonology department and ENT department of this Bombay Hospital and Bombay Hospital Medical Institute. Thing is, what happened is a month back or so, I had come here for consultation about my son. Ritik Mali is my son. So he is around 25-26 years old, and he was diagnosed with part of sleep apnea in Belgaum. Even sleep study was also done in Belgaum. Then he was referred to this Bombay Hospital to Dr. Abhay Bansal and Dr. Rajiv Nirurkar in the department. So then after coming here with the proper way of consultation and other procedures, my son underwent the DISE procedure. DISE procedure is nothing but sleep endoscopy. Your sleep pattern is studied by using anesthesia. So sleep endoscopy is done, I think only center here, I think is done here. And with that they could get all the views of my son's nose, throat, and all the deeper aspects, and they could study the measurements, they could study the parameters causing his sleep apnea. So with this, they're doing a wonderful work. They made a proper tailor-made plan because the treatment varies from person to person, from patient to patient. Because the factors which are causing sleep apnea are very different and very variable. So depending on his condition, they made a tailored approach. And we got admitted last week only. Probably we admitted, and Dr. Rajiv Nirurkar from ENT has operated with all the procedures which are required for his sleep apnea. Now post-operatively, patient is doing very well, and I can say that I'm extremely happy to say that the results and the outcome is very good, and the approach of the doctors, and not only the doctors, even the staff nurses, everybody is very cooperative, very good, and I'll be, I can recommend this to anybody else. It's really good hospital with all the infrastructure, with all the facilities, the staying facilities low, everything is good. So I can say that this is one of the best centers treating such conditions, and I wish all the best to Dr. Abhay Bansal and to Dr. Rajiv Nirurkar and his team. Thank you.
So for obstructive sleep apnea, although CPAP or positive airway pressure devices remain the gold standard for majority of the patients. A subset of few do not tolerate it well or can be offered different treatment modalities such as surgical correction, myofunctional exercises, weight loss drugs, mandibular advancement devices. So we at Bombay Hospital offer all possible treatment modalities when it comes to obstructive sleep apnea.